Mission on Cancer. The third amendment to the Horizon Work Program 23 has been published. And at today's session, we will present you with the goal topics we have included under the work program. And I realized that I'm not visible on the screen. Okay, we'll put it around with this. Apologies for that. Anyway, we will first also outline the background of the mission, including synergies and an explanation about what project clusters are. We have our colleagues from ADEA that will give a presentation to give an overview of the state of play of the implementation of the Mission Work Program 21 that we do today. Importantly, the recording will be available on YouTube, so you can always go back to it. And I'm confident that this program will help you better understand what we would like to see happening under the mission and the action plan therein. It's also important for you to realize that missions are about also introducing new approaches. And I hope that this information will help you understand what that is about. So it's my pleasure now to hand over to my colleague, John Ryan, who is the Acting Deputy Director General for Health and Food Safety of the Director General, DG Santé. And he will update us on the European Cancer Plan. As you know, the Mission on Cancer and the European Cancer Plan are synergistic with one another, because what we want to do is to have, for Europe to help tackle cancer at European level. Over to you, John.
Yes, thank you very much, Barbara. Good afternoon, ladies and gentlemen. It's a pleasure for me to open this session on the Cancer Mission. The program today, I hope, will give you a good overview of this year's plans for the Cancer Mission. The Europe Beating Cancer Plan works in synergy with the Cancer Mission. These are two policy initiatives from the Commission, both of which work hand in hand. And I'm responsible for in some ways for both, because I'm dealing with the Cancer Plan, and at the same time, I'm the Deputy Mission Manager on the Commission side for the Cancer Mission. And I'd like to give you some information on the main areas of work that we're planning for this year. So first of all, the first topic I'd like to deal with is cancer screening. And to inform you that last December 22, the Council of Ministers adopted a legal text on cancer screening. We call it a Council recommendation on cancer screening. And the Commission has already made available through the health programme approximately 38.5 million euros to reinforce cancer screening initiatives in 2021 and 2022. For the implementation of this recommendation, which was, as I say, adopted in December last year, we're now making available a further 38.5 million this year to support member states and also to develop guidelines for the 3 new cancer sites of lung, gastric and prostate cancer. So having already invested money in 2021 and 2022, we will be reinforcing the support for member states for cancer screening rollout, and also for guidelines for the 3 new cancer sites in 2023. Another important part of our cooperation between the Cancer Plan and the Cancer Mission is in relation to the establishment and the networking of comprehensive cancer centres, comprehensive cancer infrastructures, in other words. And we have ongoing work in joint actions, which are joint projects between the member states, which will receive this year further significant funding to implement the planning work which was started last year. As part of the Cancer Plan, the Commission has also adopted the CIMERA Action Plan, which is to do with the safety, the quality and the reliable use of radiological and nuclear technology in healthcare. So the Cancer Plan is also including this aspect of radionuclear medicine. And to support the implementation of these activities on radionuclear medicine, We will be launching several actions in 2023 to carry out a clinical audit campaign, a study on radionuclear medical devices, and again, support actions with the member states. In terms of policy initiatives planned for this year, later on in the year, the Commission will be adopting two proposals. The first one dealing with vaccine preventable cancers, where we know the situation has changed considerably in the last few years. So this would be proposing a new approach for member states to agree on vaccine preventable cancers. And secondly, a similar EU initiative on smoke-free environments. So extending the existing legislative arrangements on smoke-free environments to new settings and new indoor environments. We will also be looking this year at mental health and mental health issues arising from cancer for patients, their families, and their carers. This is because the European Commission will be developing an initiative on mental health more generally in June of this year. As a last point, I'd like to draw your attention to some events which are coming up and which might be of interest to you. First of all, around World Cancer Day, we're co-hosting a conference on cancer with the Swedish presidency of the European Union. This will take place on the 1st of February in Stockholm. And there will be different chapters in this meeting, but they will cover, for example, prevention, early detection, and also a specific focus on health data. And among other speakers, Walter Riccardi, the chair of the Cancer Mission Board, will be speaking at this conference. At the conference, we'll also be launching the first edition of the country cancer profiles. And the idea of this is really to identify the gaps and the inequalities of access to care for cancer patients across Europe. This is work which has been developed for the Commission by the OECD. And as I say, the first edition of these country profiles will be published on the occasion of this Swedish presidency event. And we'll also be organizing a webinar on the following day, on the 2nd of February. So both of these events will be taking place online, and of course, you're more than welcome to participate. The third event, which I'd like to mention, is in relation to cancer imaging, and this will take place later in January on the 23rd, which is also an important landmark flagship, if you like, of the cancer plan, which has close links with the cancer mission. The aim of this initiative is to foster innovation and to facilitate the deployment of digital technologies in cancer treatment and care to achieve more precise and faster clinical decision-making, diagnostics, treatments, and predictive medicine for cancer patients. So I hope in these few words I've been able to explain to you a little bit the link between the policy initiatives on the cancer plan, which is a Commission-wide plan, and the important investments which are available through the cancer mission, both of which are very complementary and closely linked. And 2023 will be a major year for a number of these initiatives, and I'm very happy that you've shown the interest to join us here today, and I hope you'll be able to learn some more. Thank you very much again, colleagues.
Thank you very much, John, and indeed a very rich agenda of upcoming events and activities and actions. As this is an online meeting, we thought it would be useful to give you all a sense of who is there with us. And we are going to use Slido to get an answer to that question. Go to the slido.com website and use the code #missionsinfoday. And then you will need to select this session, Cancer Mission, which is right above the hashtag, in order for you to be able to participate in the poll and to ask questions. So we will have 2 rounds of Slido questions. The first is about getting to know you, and the second will be more on the questions that you have for us. So we will start with what you see online now is, which country are you from? And I see that people are typing, so let's wait a little to see. Germany is well represented, Spain as well. Happy to see that Poland is there, and Portugal, Estonia, Belgium. Please go on. Sweden, important, also seeing the Swedish presidency. Slovakia, Iceland. Yes. Okay, so quite a diverse group of participants from north, south, east, and west. Spain is very active. That's maybe because they have the mirror group on cancer. I see Denmark is coming in, Greece. Yes. Okay. Then I suggest that we go to the second question. What is your main field of expertise? And please use just one word. Ah, you've been already typing in. That's good. Well, cancer research, yeah, indeed, it would be nice. Public health, communications, if I'm not mistaken, nanomedicine, physiotherapy, raw materials, okay, colorectal cancer, public health, healthcare, exercise. I assume that is physical exercise. Anyway, the wealth of keywords that I see on the screen shows that how important it is to go across different silos and fields. And we need a lot of very many different things to make tackling cancer work. So cancer research is really the expertise in the focus, but as I mentioned, quite a lot of other disciplines are present there. So I now suggest to move over to talk a bit, give you a presentation on the mission, what it is, and gives you some background on synergies. And it's my pleasure to invite my colleague, Annika Nowak, who is head of sector in the Cancer Mission Secretariat, to give this presentation. Over to you, Annika.
Thank you, Barbara, and good afternoon to everybody. I would take you quickly through the cancer mission, which is always more difficult because it is quite a complex, mix of activities we have, and some of you might already be familiar with. So, but we always have newcomers or new interested applicants. So, let's jump into the presentation, and this is the summary of the mission as such, to remind everybody about the challenges. The goal is to meet these challenges. The goal of the mission is to improve the lives of more than 3 million people by 2030, and that should be done through looking at the prevention side, cure, and for those affected by cancer, including the families, to live longer and better, so also to put a focus on the quality of life issues. And this ambitious goal is to be jointly achieved with the Europe-Speaking Cancer Plan. And we have just heard from John Ryan all the actions that are under the plan and the close interlinkage with the mission on cancer. There are 4 mission objectives: area of understanding, prevention, early detection, diagnosis and treatment, and quality of life, to cover the whole cancer continuum. And within that, we also have, the mission has identified what we call transversal priorities, such as equity, addressing inequalities, driving innovation, childhood cancer, and personalized medicine, something you will see reflected also in the topic calls. For the first 3 years, we have a total budget of 365 million, and the mission, but I will come to that later, enjoys what we call a joint governance structure. With respect to the concrete actions under the cancer plan, so in addition to the topics in the work programs, we are already have started to develop the Uncanny EU platform, where we first need to have a blueprint, so how such a data platform should be organized, created, designed. Similarly, we also have launched now to get a blueprint for the European Cancer Digital Center. There's work ongoing and also calls under both the cancer plan or the EU for Health program and the Horizon Europe missions work program to build the network of comprehensive cancer infrastructures. There are already a couple of I actions we have launched under the first 2 work programs, which we now complement further with the newly adopted work program 23. Quite some investment of work is put into building the synergies, not only, but mainly with the cancer plan so far, but we're also looking to build synergies with other EU initiatives, with national and regional initiatives and financial instruments. With that, I would move on to detail some of the actions we are doing to implement the mission. So with regard to the synergies, as I said, we are looking to build strong collaboration and mutual support with many other important EU initiatives. Just to name a few, it's a long list. It's not an exhaustive list. There are quite some actions that support cancer policies and research. First of all, there's the Knowledge Center on Cancer, which I recommend also for you to have a look. A good summary and overview of evidence and activities. You should be familiar with the European Cancer Information System. There's also legislation and strategies in the area of pollution, of chemicals, of environmental factors. There are new initiatives in the health side, such as the new non-communicable disease initiative and the recently adopted council recommendations on cancer screening, to which the cancer mission has also contributed to. There is also legislation which has been adopted, like the European Health Data Space, a new proposal adopted last year. The pharmaceutical legislation is under review, and also a proposal is expected in the next months. There are at the same time initiatives under Horizon Europe that support the missions and where we build the synergies. So calls under the health cluster, other Horizon Europe partnerships, like the Innovative Health Initiative, but also the Euratom program or the European Bauhaus. With that, and also stressing again that the national activities, initiatives, and funding program are equally important to integrate the mission actions then at national or regional level. With that, I would move on to briefly explain what we mean by these joint governments. So the idea is that, with the cancer plan and the cancer mission, that we pursue and implement both initiatives in a consistent and mutually synergized manner. And the joint governments helps us at European level to do so. First of all, for the dialogue with the member states, we have created a subgroup on cancer under the steering group, which is now called the Public Health Group, that joins health and research ministries who advise us, the Commission, on how to best implement both cancer initiatives. Similarly, we have a dialogue with stakeholders, so there's a dedicated stakeholder contact group on the health policy platform, which serve as a basis then for discussions and exchanges. And also for the coordination within the Commission, we have what we call an EU implementation group. With that, I can move on. When it comes to the government structure, we are now building at national level. So under the work program 22, we had a coordination support action, which will help to create what we call national cancer mission hubs. So these are then structures, groups at the national or regional level that should help to integrate the mission actions, but also those under the cancer plan at the national level. Some member states, it was already mentioned in the introduction, have already created what they call mirror groups. So these mirror groups that might become then a National Cancer Mission Hub, and complemented that is at a horizontal level a project, coordination action called TRAMI, which has already started working last year. So with governance structure, I would now move on and give a bit more detail what we mean with the national mission hubs. It's about raising the awareness and coordinate the activities of the missions among the actors at the national, regional, or even local level with regard to R&I and health systems, to facilitate the integration, but really to engage the actors and stakeholders beyond R&I, to broaden that discussions, that dialogue, and initiate policy, cross-policy dialogues at national, regional level. And finally, those mission hubs should also then citizens engagement activities at national level. So this has come then this year, and we hope by summer there will be the kickoff of that project. Just a brief overview, what are the main current activities, citizens engagement. It is an important characteristic of all missions. Last year, we have started with what we call focus groups, with a group of patients whom we ask about things, prevention and screening, to get the direct feedback of citizens. Recently, last week, basically, we had a first round of virtual workshops with young cancer survivors and parents' careers that should help us to identify what are the current needs to improve the quality of life of young cancer survivors. This engagement we will continue on the 6th and 7th of February, so a second round of workshops, and then a conference on the 7th of February. We are still obviously participating in many events to enhance the awareness and the dialogue and buy-in from member states, regions, and stakeholders across Europe. Last September, the phase 2 Cancer Mission Board has started its work to help and advise the Commission to implement the mission actions, but also to act as ambassador in all of the countries and help us to integrate or to have the discussions at national level. I've already said something about the synergy, so if you find a list of the main initiatives at EU level, but also like the EIT Health, European Investment Bank, cancer charities, something which we will pursue this year with even more dedication. So the work program, but you will get that presentation in a few minutes, includes specific references where we see the synergies and where we expect also that this is then demonstrated in the proposals. I think with that, I can close my presentation. Many thanks.
Thank you, Annika, very much for that. So a wealth of information, and that's why you can always revisit this presentation on YouTube. It's now my pleasure to hand over to Kay Duggan-Walls, who is also part of the Cancer Mission Secretariat team, and who will tell you about what we're setting up under the missions related to the research project, the so-called project clusters. Kay, over to you.
Good afternoon. You may recall that sorry about that. I had a problem with my slides. As you may recall, you were asked in the work program topics to participate in networking and joint activities with other projects. So in order to build a portfolio of projects to support the objectives of the mission on cancer, project clusters have been developed. And these are to support the mission objectives, to create added value and to increase impact of EU funding, and they'll be established in the next 2 years with the European Commission and the consortia working together. And they're also established to have a policy feedback loop. So the first two clusters were set up with project coordinators funded from the 2021 calls. And then cluster meetings were held with the coordinators of these projects in September. And the two clusters were prevention, including screening and understanding. And coordinators in projects in these areas have been asked to identify what they would like to work on together. So here on the right-hand side of the slide, you can see that they work on data management, research and innovation, communication and dissemination, citizen engagement, addressing inequalities, research capacity building, and when the cancer mission hubs are set up, they'll work on those together. And these activities have been agreed and are included in grant agreements. So there are common work packages and there are cross-references in the work packages to these activities. So these are the cluster areas. We talked about prevention, including screening, which has started, and understanding has started as well. And the projects from 2022 calls have been added to the prevention cluster. And tomorrow a further cluster will be set up, which is diagnostics and treatment, and with the 2022 projects. So, and a quality of life cluster will be set up in the near future. And so before I, and by June 33 mission projects will be launched in the 4 clusters. So before I end, I just want to point out the footnote in this slide here, which talks about, which is included in the work programme. And it's something you should note because it talks about, in order to address the objectives of the mission on cancer, participants will collaborate in project clusters to leverage EU funding, increase networking across sectors and disciplines, and establish a portfolio of cancer mission, RNI and policy actions. So that's important when you're putting your proposals together. So I'll finish here. Thank you.
Thank you, Kay. And indeed, it's important to keep at the back of the mind that we want to create these clusters of projects. So you will be asked, if successful applicants, to collaborate with other projects in certain defined area. So now it's my pleasure to hand over to Yanis Vuldis from HADEA, the executive agency, who will give you an update of where we stand at in implementation of Work Programme 21-22. Yanis, over to you.
Thank you, Barbara. I hope you can hear me and you can see me fine. It's a pleasure to join the info event today, and good afternoon to all the participants following us online. I take the opportunity to share a couple of words about the European Health and Digital Executive Agency. If we can move to the next slide, please. Since it started its operation in April 21, not a very long time ago, and it's responsible to manage the following program sectors: the health, food safety, space, industry, and digital sectors. And if we move to the next slide, please. And the budget that it has been trusted to us accounts to more than 20 billion euros for the current financial framework program up to 2027. And maybe I can draw the attention of the audience to the orange and yellow parts of the pie, that they correspond to the Horizon Europe and Health Cluster, and they're linking to the Cancer Mission, and with the yellow to the EU for Health, linked to the Europe's Beating Cancer Plan. In the next slide, please. And as the granting authority, HADEA has clear and distinct responsibilities and duties versus the policy DGs, such as the research and innovation and health and food safety that define the strategy and they set the work programs, whereas our remit lies with organization of the calls for the proposals with external independent expert evaluators and following up the entire implementation life cycle of the projects. And of course, providing feedback back to the policy making. We may move on, please. Next slide. And now it's a pleasure to briefly outline the work program 21 and 22 topics and the results. And we can start with the next slide, please. On the one that we have for preparing UNCAN.eu, a European initiative to understand cancer. It has been the very first project as a coordination support action that it's fully running. You can find the information, of course, in the Cortis platform, but on the dedicated as well project website of the project that of duration 15 months. You can see the key data. The 21 member states are participating, 29 partners in total, and a total budget of 3 million euros. Among, of course, the objectives that you can see in more detail, and we can move on because the purpose now is to give you an outline of what we have done. And with the 21 core topics, you can see the overall statistics that we have a budget of 125.6 million euros with 106 proposals received, 12 funded proposals in total. I'm going in shortly into a bit of more details. And in these all funded proposals that now became projects are starting the implementation now in January 23. There are no dedicated websites yet, but soon they will come. But of course, you may find, if you wish, show further information via the Cordis, the EU Research Results platform. And we can move on to show the overall statistics on participation among the EU member states for these funded proposals. We had, in terms of country participation, as you can see, Spain, Germany, Italy, Belgium, and France on the top participating countries. And among the associated and third countries, we had Israel, United Kingdom, Norway, Switzerland, and Turkey. And we move on to see which are these exact proposals, projects that we have now. In the next slide, please. If we may move to the next slide, please. Here we are. Very nice, thank you. So for the specific 210201 topic, to develop new methods and technologies for screening and early detection, my colleague Kay has already mentioned the cluster that it's linked to these projects that they have all started, and you can see them in Cordis on their websites. What comments I would like only briefly to make is that in terms of cancer and coverage, you can see that they concern breast cancer, colorectal, pancreatic, hematological malignancies, and colorectal again, and the entities, the organizations leading the coordination of this project, they spread around also research institutes, industry such as small and medium enterprise, and academic institutes. And with that, we can move to the next two topics. The 0202 is to develop and validate a set of quality of life measures for cancer patients and survivors. It has resulted to EU on quality of life project, quality of life in oncology, measuring what matters for cancer patients and survivors in Europe, led by an organization in Italy. And we had also the 0203 topic to better understand healthy versus cancer cells at individual and population level. And here you can see in a similar way in terms of cancer type and coverage, we had melanoma for children, adolescents, and young adults, multiple myeloma, hepatocellular carcinoma, lung cancer, and poorly understood cancers that they have been renal, pancreatic, and colorectal types of cancer. Again, the institutes leading, they have been quite diverse in terms of academia, research institutes, and we can move with the next slide that we have now the 22 core topics and the general statistics that you can see here. We had 5 topics, 3 coordination support action, 2 research and innovation action, and a total of 34 proposals received. with 20 retained for funding. That means being successful to receive funding, and all these 20 proposals are currently at grant agreement preparation phase, governed by confidentiality principle. Therefore, it's only this information we can share at the moment, but it's expected in spring 23 all the grant agreements to be signed, and more information as previously will be made first available in the Cordis database. And with that, you can see that we had also quite a high success rate for most of the topics, and one topic has received no application. And with that, I think that's it. I would like to thank you also for following me. Thank you.
We would like to give you the opportunity to ask questions. So questions that focus on what you've heard until now about the EU mission, the synergies, the clusters, the work program 21-22, because you will have the opportunity after our next presentation to ask questions related to work program 23. So for now, you go to Slido, hashtag missions info day, then you select cancel mission and you post your question. So I will wait a little for people to gather their thinking, and as soon as we get the first series of questions, we start answering them. Once again, to clarify, this concerns what has been presented to you so far. It does not concern questions related to work program 23 yet. And while we're waiting for your questions to come in, you're free, of course, to grab a coffee or a glass of water or anything like that. Yeah, we're in the process of posting the question. Bear with us. Questions have been coming in. We are answering the questions that specifically relate to the presentations given so far, because we want to focus the questions on work program 23 topics later on after the presentation. I'm just checking. How do you explain no application in 2022 coordination and support action? This was the coordination and support action related to the setting up of the European Patient Digital Center. Our assumption is that people were not clear enough on what exactly the purpose of this coordination and support action was. And therefore, let's say potential applicants didn't gather enough momentum. to be able to present a good proposal. I just wanted to highlight that we've commissioned a study that will help us develop the blueprint for setting up this European Patient Digital Center. And in that process, during that study, consultations will be held with all kinds of different types of stakeholders, and probably it becomes then a little bit clearer what the idea would be for this European Patient Digital Center and how national and regional levels should be involved. So the next question is, which influence does the stakeholder contact group have? In terms of the stakeholder contact group is what it is. It is supposed is a platform for exchange, whereby on the one hand, we as Commission, be it DG Santé ourselves or another DG, gives regular updates on the state of play on implementation of the Beating Cancer Plan or the Mission on Cancer or anything related to cancer. And vice versa, stakeholders can also make either suggestions for topics that they would like to discuss or give a presentation. I don't know, Annika, you want to add to that?
Maybe briefly, you can should be able to find, last year we had, I think, 3 webinars, so you should find still the recording to see, you know, how we organize that. And the idea is also now in 23 to consult that group on specific issues, but also broaden the scope or let other DGs present cancer-related initiatives. So I think it's a very informative and gives the stakeholders the opportunity to give direct feedback on these initiatives.
So then I see a question about the mission board. So we had to define the mission. We had a phase 1 mission board, 15 experts under the chairpersonship of Walter Ricciardi, who developed the mission goal and the main recommendations for the implementation of the mission. Then now we are in phase 2 of the mission board, meaning that the board members will focus on the implementation of the mission. So they are involved in the sense that the chair and the vice chair participate in the subgroup on cancer, so that they are aware of the discussions that we have with the member states related to cancer. But also, for example, in the preparation of the conference on young cancer survivors, we've had board members that have participated in the online workshop we organized and will participate in the workshops and the conference in itself. Then we have also agreed with the mission board members that they would be in contact with the clusters, follow the clusters that Kay presented to you, so that they are aware of where the science is at and can give feedback if need be. And then we have an important role for the mission board members, is the role of quote-unquote ambassador. What do we mean by that? That each of the board members has agreed to, let's say, follow up closer what is happening in the country where they live in, plus 1 or 2 other countries. We've piloted this under the first phase of the mission board, and it was quite, let's say, relevant and interesting to have, first of all, being able to cover the different countries within Europe associated to the mission, but also get feedback. So these are then they also will be involved in helping us develop or further finalize the monitoring framework for the implementation of the mission and all, let's say, assessment exercises that will take place to see how we are doing. Annika, you want to add something on that? No? So how is the mission engaging with citizens? Is this possible? Well, engaging with citizens is basically reaching out to a group of people that have the same characteristics or not. So this is something new for the Commission as a whole and for the Mission on Cancer more specifically. So basically, Annika can tell you a little bit about the focus group that we organized last year. Just to say that the citizen engagement is, in the end, we need to be able to how to say, meet the needs of the citizens. And citizens have different perspectives on what is needed to help them prevent cancer or being treated for cancer. So it's by reaching out that we get a better idea of what is important for people so that we can focus our actions. And that is, by the way, something that you will see in the work programs for the mission. We really want the research community to reach out to patients, people, to help them identify the needs that they think they can achieve by doing the research, but also involve patients, citizens in the design of the research, because sometimes there's a big gap between the research that is ongoing and the results that are delivered, and these results then don't really match the need of the end user. So this is Annika, on the workshops, you want to add something?
Maybe briefly, yes, indeed, it's a new activity. And there's also what was just said, that the Cancer Mission Board, some of the members that have an expertise in that respect, helped us to have this direct interaction with young cancer survivors and parents. First of all, that they share their experience, but that help us really to identify, what are the needs. So we had concrete questions and invited them to provide that feedback. But in the second round, it will be more concretely on existing actions, initiatives under both the Cancer Mission or the Cancer Plan, that we seek their they direct input in the sense when it comes to their needs, what exactly is missing, what they felt in their particular situation, something which might not yet be captured, so to say. Maybe it's more a need of information, and where to find that information, so that we can see that might shape then, for example, the European Cancer Patient Digital Center. Is that a solution to their needs? So it's really matching, but helping to shape the actions which we have foreseen under the mission.
So then I have a question on the clusters, that they are represented by the same countries. No, we're clustering projects that have been successfully evaluated and for which a grant agreement will be signed. And we ask them to work together on areas that are of common interest to them. So it's not the same countries, depends on which the consortium are. But Kay, you want to add anything on that?
Only just to say that the clusters are represented by different consortia, and the consortia will have a lot of members. So all of the countries that have been successful will be represented in these clusters. And for the first cluster, we had 6 coordinators, and then for the one next week, or later this week, they're going to be 12 coordinators. So that, and each of those teams will have a major team. So lots of countries will be represented.
Thank you, Kay. So how is the mission introducing new approaches? Well, there are various new approaches. One was already presented by Annika, the joint governance systems that we have developed, in the sense that when we talk to the member states, we have created a subgroup in which both health and research ministries are represented. When we talk within the Commission services about how to best tackle cancer, we talk about implementation of the Mission on Cancer, the Beating Cancer Plan, and any other cancer-related initiative implemented by another DG. So that is one innovative approach. The second innovative approach is the use of the portfolio approach, whereby we try to shape a portfolio of projects that help us to achieve the mission goal, and whereby there's the possibility to indicate that you want to have a minimum number of projects, for example, tackling childhood cancer. A third new approach is the citizen engagement, which so far we have not explicitly done within the health research environment. And now this is something that is systematically put on the table, and we will develop the methodology and discuss with the member states how we can improve on that. So this is there's a few elements that we are introducing, and we are also very open to other suggestions of innovation that we should take on board, whether it is in the member states or at the Commission level. Then I see a question, something about all the country cancer profile or just for some countries. That is a question for, I think Annika can answer, or John is there. John, could you help answer? For the conference on the 2nd of February, where you refer to the fact of country profiles being presented.
Yes, thank you very much. On the question of the country profiles, the idea is to analyze for the 27 member states the situation regarding inequalities of access to cancer care, treatment, early detection, and so on. So we've been working with the OECD in order to gather relevant indicators and then to analyze those indicators, but with the focus on identifying where there are big differences, important differences in the access to different aspects of cancer treatment, care, prevention, early detection across the member states. So the answer to your question is that there will be 27 national reports, and this is the first concrete outcome of the Cancer Inequalities Registry, which the Commission created as part of the cancer plan. And the intention is to use these reports as a means of targeting the areas where investment is needed. Now, the investment could be, for example, in training. It could be that there are shortages of adequate health professionals working, oncologists working in a particular field in a particular member state. So we could perhaps target investment in that respect. Could also be that there are gaps in the availability of radionuclear medicine screening, for example, in certain member states. And we could also look to see how European funds or European projects could be targeted in that respect, and so on. So the idea is really to try and use the data in an active way rather than just collecting and publishing another report. The report, we hope, will be the basis for discussion and for steering investments and efforts to those areas which need it the most. I hope that's helpful, Barbara.
Sorry, Barbara, it seems you are muted.
Oh, sorry. Yeah. So another question on mission innovation and innovative approaches. There I wanted to also highlight that, for example, the reference that we been making in work around 21-22 on the living labs is something that we consider as an innovative approach. In the future, we might also encourage more high-risk approaches to address a particular problem. Yeah, I'll leave it at that. Okay, so this was the first wave of questions. We will now enter into the part of the information session that deals with work program 23. And to do so, we will first ask you again questions because we have two questions for you. Again, you will answer them in Slido. And the first question is, out of the work program 23 that you have seen, which core topics are you most interested in? And if you could possibly use the code of the topic as well, it would help. So which core topics are you most interested in? Of work program 23, of course. Yeah, we're trying to share the screen. Bear with us. I know you were active replying to the question, but yes, it's coming. So the poorly understood tumor-host interactions topic is not going to say it's the winner, but has a lot of votes. And then we go to primary cancer prevention through sustainable behavior share. Okay, I suggest, because you can look at the percentages yourself, it's interesting to see this breakdown. But in any case, we expect high quality proposals for all of them. So that's it for me, at least, the most important part. Then we have the second question, where you've looked now at, we've presented to you what we funded, what we launched in Work Program 21-22. You will see and have seen Work Program 23, but which other areas do you think should be funded under the Cancer Mission in the future? So beyond what you've seen so far, what do you think we should be funding? Areas, not, yeah. Rehabilitation comes up. Environmental health, vaccine development, prevention of metastasis, targeted alpha therapy, societal awareness. I assume that that is more awareness and understanding of what cancer is and develops at the level of society. Rare cancers, prevention, new biomarkers, radiation protection, screening programs. Yeah, I see that screening comes up, so we've put forward topics on screening, but apparently you feel there should be more. Okay, it's a quite varied precision medicine in the sense of personalized medicine, I assume, patient education, patient certification, data harmonization. Ooh, that's a good challenge. Lifestyle factors, indeed. Biomarkers. Okay, I think this is, we will capture these words also, they will be posted online as well, for both for your use and our use. So we now move over to the presentation of the Mission Work Program 23, and it's my pleasure to ask Jan van der Loo, our mission lead of the Cancer Mission Secretariat, to present. Over to you.
Yeah, thank you, Barbara. Thank you, everyone, for listening in to this information day all over Europe. I'm going to, in the second hour, we're going to spend more time on the Work Program 2023 for the Cancer Mission, which is 4 topics with a budget of 110 million. So this is just to sort of give you a flavor for what we have done when it comes to the mission work programs under the Cancer Mission, apart from all the other things that my colleagues have already mentioned. So in total, we have now published 13 topics. And these 13 topics cover all the main 4 objectives of the Cancer Mission, which is understanding, which is prevention and early detection, which is diagnosis and treatment, and of course, quality of life, which is becoming more and more important in cancer as we are managing to keep more people alive with new treatments and better prevention interventions. So I just want to mention that you will see again in this work program that we are applying sort of mission guiding principles, that we continue to work in mission clusters to get those portfolios up and running, that there are strong synergies with Europe's Beating Cancer Plan. Although they are not directly mentioned in the topics are complementary or add to Europe's Beating Cancer Plan actions. And the topics in color are going to be discussed in more detail today. So if I can have the next slide, please. So the topics in the, and I said cancer guiding principles, mission cancer principles is about, we try to summarize it in this slide, is about the way we set up portfolios. It's about how we want to involve citizens, including patients, in these research proposals and projects, and also about end user involvement. So first of all, more administrative information for all of you is that we have, following the first two calls, we have decided to increase the threshold from 10 to 12. So the overall threshold is now 12 and was 10, because we see that the proposals and the ideas, the applicants clearly show that the mission guiding principles are being introduced quite well. So we thought we could raise the thresholds. As part of the mission, we consistently aim also for involving other disciplines, other sectors, far beyond business as usual. So really out-of-the-box solutions. This is all possible under the mission work programs. So not only cancer, but also the other 4 missions. And so we are doing our best to explain that to you in the topics that we publish, and we also explain it in the meetings that we have with the program committee members, with all the member states at the time of preparing these work programs, so that we, you know, it's also clear for the member states and their experts in their countries what it is that we aim for. So another and third aspect of this mission sort of characteristic is that we want to see extensive networking whenever that is relevant, and we have tried to indicate it in these topics by mentioning initiatives that are going on. For example, we refer to a partnership called Photonics Partnership. We mention other ongoing projects, infrastructures, but if you have any other ideas for networking, these are mostly welcome. The only thing that we ask at the time of submission is that you add some detail on your networking activities, but most of all that you budget some money for these networking activities to take place once your project is going to start. And this is, of course, relevant for what we call these project clusters, but you may have other ideas and they're most welcome. So then one word about citizen engagement. This was already mentioned in the presentations by my colleagues. So we really want to see a broad participation of civil society, not only patients, but also citizen representatives representing NGOs, different parts of society, caregiver organizations, community. They are consistently addressed in these topics, and we really want these organizations to come forward and to be active in these projects. Now, when it comes to end user engagement, so we have given examples in the topics which are Living Lab, for example, the Living Lab, participative approaches, but there could be other sort of end user involvement in research. These are mostly welcome. This is the example here is just what we think we know exists, but there are many more available in Europe, and we welcome any other sort of participative research model to come forward. So then the next slide is the first topic that I wanted to go with you through today. So I'm not surprised that to see from Slido that this is the topic that comes out as most interesting for the participants attending today, because this, of course, is a very hot area in cancer, because tumor-host interactions, although that have been researched for many, many years, with the recent successes of immunotherapy, we understand that it's exactly in the tumor host where interactions where we need to improve to get improvement of treatment and care interventions in general. So just first of all, the page limit for this topic. We thought, given the increased budgets for these proposals, we would need more space for you to write your ideas. So the page limit has gone up to 70 pages. And for the rest, The same mission guiding principles apply. So the scope is really about a better understanding of processes that underpin tumor-host interactions, and the focus is on poorly understood cancers, cancer subtypes in any age group, any cohorts, in society. This is all very much welcome as long as they are poorly understood. So it could even be, for example, colorectal cancer, but you could focus on, for example, metastatic subtypes in breast cancer. This is all possible. And the reason why we focus on poorly understood is that we must try to maintain some focus in this very, very broad area of cancer research that is, globally of major interest, and also because of the impact we want to get through the cancer mission and the cancer plan. So we thought that when we work on the understanding objective, we want to focus on poorly understood cancers or cancer subtypes. So the scope of this topic also is about combining knowledge and any type of high quality data for biomedical clinical studies, other cohort studies, for example, about environment or could be basically anything using artificial intelligence or computer modeling. This is all very much welcome. In the end, what counts is that the expected outcome that these proposals at the end of the project duration are going to deliver an outcome that would help at least health policymakers to become more aware of the importance of tumor-host interactions in cancer patients and in the care for cancer patients, so that they can then do something with this knowledge to, for example, set up better cancer innovation or health policies in the member states or associated countries. We also expect that at the end of these projects, researchers and professors from different disciplines have access to data that are sort of standardized, that are reusable, accessible, and are going to support the Understanding Cancer research data platform, which is currently in preparation. So we expect that these proposals take note of the Understanding Cancer platform, its principles, and make sure that some interactions are going to happen throughout the lifetime of these projects. And of course, we also expect that at the end of these projects, there will be novel information on how to best leverage the knowledge on tumor host processes for better cancer treatments and care interventions in children, adolescents, adults, and the elderly. And as you see in this slide, we have highlighted the words "and." And this is just to reply to queries from several of you who were concerned that the proposal had to address all these age groups. The answer is, of course, no. It's just that the topic as such wants to cover all these age groups, but the proposal is, of course, eligible to address any age group it thinks would make sense for that fits best with its ideas or state of the art. Can I have the next slide, please? So the second topic, Work Program 23, is about, again, about primary cancer prevention. And this time, we thought it would be important to even put more into focus sustainable behavioral change. So we launched a similar topic in Work Program 2022, and these projects are being prepared to start. This topic is different in the sense that behavioral change is more important, but also we tried in discussions with the other missions to create some synergies with the other missions, because all these missions have the common denominator, which of course is prevention of cancer through efforts when it comes to climate change, to soil health, and for example, think about air pollution, air quality in cities. So that's how this topic came about. The scope is, again, about primary cancer prevention programs. So how can they be made more effective for people who are responsible for primary cancer prevention programs in member states, associated countries, or regions. These proposals should include information about evidence-based cost-benefit analysis of the programs that they propose. They should address specific bottlenecks and barriers. that would prevent the uptake of, for example, sustainable behavioral change, which we know is a tough nut to crack. It should also identify the most appropriate actors in countries and regions to develop those incentives. Attention to health determinants, including occupational and environmental factors, is important. But again, you can choose anything that has been widely published and for which we know the evidence is available. And important is also to include approaches that show how you're going to reach and involve disadvantaged socioeconomic population groups, vulnerable groups, people living in, for example, rural areas. These are all important because these are exactly the parts of society where we know cancer is a bigger problem and who in part are more difficult to reach. And so any idea to reach those groups would be most welcome. So the expected outcomes therefore reflect the scope. So again, the outcomes of these projects should really help regional, local, and national policymakers to, promote new programs that can be implemented and really, hopefully, make it possible to address better behavioral change and psychosocial requirements. We also expect that the citizens, including those at high risk of developing cancer and those like cancer patients and survivors, would benefit from easy to understand and accessible tailored recommendations and support programs, because we know that this in part is missing. And that so would address the, again, behavioral changes. And a third expected outcome is that we expect that, again, citizens that are at risk of cancer, cancer-based survivors, and the word "and" applies to the topic, but not to your individual proposal, would benefit from outcomes of these projects, in the sense that the new health promotion primary prevention program would be available that include behavioral change and psychosocial approaches. And again, address the issues I just mentioned, such as rural areas, urban areas, remote areas, anything that could help reach more people when it comes to primary prevention. Can I have the next slide, please? Third topic is a topic that we published also in 2022, which is a topic that supports pragmatic clinical trials. This time, the trials are not focusing on the treatment or care interventions themselves, but they focus on diagnostics. So these are randomized trials, or so-called diagnostic randomized trials, with a strong pragmatic focus. When it comes to, let's say the mission guiding principles, they are I think, well described in the topic. The only additional thing that we want to mention is that if you intend to, to design your trial, you must use the clinical trial annex that that is available, trial annex template, in the funding portal, tender portal for your submission. So the scope is rather straightforward. So this topic excludes translational research per se. It is fully focused on trials. So you should submit proposals that have, a clear design and randomized trial that is going to address diagnostic interventions. So the effectiveness of diagnostic interventions, that means that they can be implemented by healthcare systems as soon as the results of your trial are known. And if I can give one example, was the MINDEC trial that was conducted several years ago, and which led to the testing of the mammoprint test for breast cancer patients, and was implemented very soon thereafter in several hospitals in several countries in Europe. So the diagnostic intervention should be adapted to the needs of the target population. Gender is an important issue, of course, but it should, as pragmatic trials, focus on the local, regional, national healthcare settings. It should really reflect that diversity across member states and associated countries. And I think pragmatic trials, in this sense, offer a unique opportunity. So depending on the priorities in your country, priorities of your healthcare system, you know, these trials may have an important impact to in the future of healthcare in cancer healthcare in your country. We also like to see that these proposals clearly justify the evidence to support the trial that you propose or the trials that you propose. You can, of course, propose more than one trial. And as part of the mission guiding principle, and as we did before, we want that the primary and secondary endpoints of these trials are going to be designed together with citizens, so with cancer patients, for example, and their caregivers. And this is possible, and any sort of participative model you think would be useful can be applied. Stakeholders, we have given a range of stakeholders that you could include in your proposal, and this is entirely up to you depending on your ideas and objectives. And the only thing that we would want to sort of set as a threshold is that we want to see these projects to be completed within 5 years from the start, because with the mission, the cancer mission and the other missions delivering by 2030, we actually are in great hurry to complete a number of objectives, and we think that by setting these sort of time limits, it should be possible, not for all types of research, but for quite some research to deliver results in about 5 years. So once more, sex and gender related issues must be taken into account. We know how important they are in cancer. And if I just may give one example, you know, there is now also clear evidence that when it comes to glioblastoma, there are important sex differences that play an important role when it comes to the treatment of these patients. So the outcomes of these proposals is that at the end, there should be new solutions for optimized and affordable, minimally invasive diagnostic interventions that would increase the quality of life of cancer patients across European regions, member states, and associated countries. We also expect that healthcare professionals and academia at the end will be able to deliver better outcomes for routine healthcare, including quality of life for men and women with cancer. And this may also be focusing on comorbidities, as we mentioned, and side effects. And of course, we expect that national healthcare providers, policymakers, and authorities in European regions, in member states, in associated countries who have, you know, the authority, who are responsible for national healthcare provision, would be able to have evidence for them to implement in a relatively short time frame optimized or at least affordable minimally invasive diagnostics in their healthcare system, depending on their priorities. Can I have the next slide, please? And then we have a fourth topic, which is a topic on establishing best practices and tools to improve the quality of life of childhood cancer patients, childhood cancer survivors, and their families, their caregivers in European regions. So this is, in contrast to the other three topics, this is an innovation action. And we thought we wanted to start small. So the idea is that we would support one proposal of up to 6 million. The important requirement, as this proposal is going to focus completely on, let's say, delivering some of these best practices and tools to support childhood cancer patients and children with cancer in remission in regions, that there is a written commitment from the regions that are the subject of this proposal, that regions are going to contribute and support the objectives of your proposal. We also want, as we have described, that there's going to be a link created with the project that is about to start, which is called EU on Quality of Life, which is a major project which is going to set up a number of surveys across many member states and to then analyze those to develop new metrics for quality of life. The scope, therefore, is that the proposal should come with new best practices or optimized best practices and validated tools that we know exist at a smaller scale in several countries. And they could relate to anything that is relevant for quality of life of childhood cancer patients, survivors, and their families. So it could be sports, it could be education, it could be facilities that, for example, take into account the transition of childhood cancer patients or young adults when they leave hospital to rehabilitation and bringing them back to their, say, practical life matters, to private life, professional life, education. So it could be care units that focus on the mental health of these patients and survivors. Anything is welcome. It could address infertility. I mean, I think you all know what the major issues are for childhood cancer patients and those who survive. So, however, the scope should be that we want to see at least 3 different regions and 3 different member states or associated countries to be addressed. And this is just to start. So this is really a pilot. If this is going to be successful, we may be doing more in the future. So the proposal should address hurdles, factors, and situations, any situation, any sort of bottleneck that would impede implementation of such good practices and tools in real life settings. Again, sex, gender, age, and any other relevant variables such as socioeconomic status, rural areas, remote areas, education. This is all very much welcome and should be addressed to the extent possible, to the extent that is relevant, because we understand that regions, member states, the situation is very, very much different from one region to the next. So we expect to see different priorities in these proposals to come forward. Of course, this being an innovation action, we expect that several of these practices that we know exist or tools should be chosen and scaled up together with childhood cancer survivors and their families. So again, the idea of involving closely citizens in the design of your proposal and in the execution of your proposal. And any participative research model would be welcome. We have mentioned oncology-centered living labs, but any other approach is most welcome to deliver the innovation in this proposal. So social innovation in this case. The outcome is that at the end of this one project, we will see new tools and new best practices to support those patients, support those cancer survivors and their families through better supportive care or personalized counseling programs or education programs or sports programs or exercise or anything that you think is useful. And this could include digital tools that would make this more successful or more accessible. Think, for example, of people living in remote areas. And we expect that healthcare professionals, supportive workers, and counselors would have the information to really drive new programs in their regions, in their member states. So I think, can I have the next slide? So I want to conclude with the references to what we have mentioned in this session. And with this, I would be listening to your questions and answers from us.
Sorry. Thank you very much, Jan. As you will see, we're now opening the Slido again. And this time is for you to pose the questions that relate to the 4 topics that were presented to you this afternoon.
So in the meantime, while participants are thinking of questions and reflecting what they want to ask, what I want to mention already is that we are going to soon after this information day, we want to wait until today. We're going to publish a series of frequently asked questions. So that's essentially all the queries that we have received to date will be put online with a clear answer so that everyone can see these queries and everyone can use it to their advantage for and when preparing proposals. Thank you.
So you're going to see the questions and we will discover them together with you. So Jan, the first question is for you. Does pragmatic imply that the tested diagnostic tool has already tested in a clinical trial and is in CE marked or FDA approved?
So yes, this is of course a question that one would expect. So let's say the diagnostic tool that you want to use as sort of the center of your trial should be a tool that has already shown its efficacy, because pragmatic trials are beyond the efficacy phase. So the test must be somehow validated in the country or countries that you are going to conduct your clinical trials. So it may be that it has CE mark or FDA approved, but the bottom line is that these trials, these diagnostic tests, these medical devices are allowed for use in your country.
Then the second one is on the Cancer 101, the understanding one. Are clinical trials within the scope of the topic or even required? Jan, over to you.
Yeah, so from the topic description, we hope at least it's clear that trials are allowed, but certainly not required. So tumor-host interactions is so much that needs to be done still after all those years that I would define as preclinical research. And so preclinical research is very much welcome in the topic as we have described it. So it is within the scope, but it's certainly not required.
So then you can take the next one, Jan, as well.
Yeah. So the question I see on my screen is whether researchers would need to use retrospective real-world clinical data, or could they also, or instead, recruit patients? I think to know where this query comes from, because we received it in writing, and so the answer is again that the topic 3 is about pragmatic trials. So as pragmatic trials are all about the real world situation, local healthcare settings. So the answer is yes, researchers can use retrospective real world clinical data. And more of these data are available in electronic health records, for example, but they could also opt to recruit patients for these trials.
Thank you. Then there's a question on the understanding topic. Would the proposals that cover all age groups be more likely to get funded? There, as Jan mentioned, you can choose. You don't need to cover all. And basically, your proposals will be evaluated against the quality of the science, the excellence of it. And sometimes it doesn't help to group everything together. But Jan, you may want to add.
Yeah, no, I would like to mention, so we have been funding cancer research for many years. So we know that what always counts is that your proposal is focused, it makes sense, and and that your ideas are really come through in a clear way, that the information you present is clear, that the data, the evidence is clear. And so it's not that if a topic says you have to do A, B, C, D, and E, and maybe also F, that if you do this, you have a higher chance of success. What counts is that your proposal is credible, is focused, and stands to make an impact.
Yes, Jan, and then see the question on fully understood, whether that includes rare cancers.
Absolutely.
So that's a simple answer. And then the next is about gynecological cancer, whether we expect both genders. No, for me it can be one type of cancer that affects one gender, but I may be mistaken, so I leave it over to Jan.
No, sure. I mean, if a person wants to focus, because we do not ask for focusing on gynecological cancers, but if a consortium wishes to focus on gynecological cancers, it could focus on one gender instead of two. So that's no problem.
Then I see the next question is about randomization for diagnostic purposes. I'm not sure how to understand that question because
so the question came also in writing from the same NCP, and we have answered this question. So randomization, diagnostic randomized trials have been described in the literature for over 20 years now. I mentioned the example of the MINDEC trial, but there are quite some publications that explain how you can randomize diagnostics in clinical studies. And I think as this is all described, I'm sure that the researchers, physicians, companies that may step in these proposals will be able to find that information and know how to deal with this.
Thank you, Jan. And then the next one about the trial sites, can they be located in third countries?
Yes.
So, and then just to add to that, if the beneficiary is in a third country that is not associated to Horizon Europe, that beneficiary will not receive funding, just to be clear. And it's not if the beneficiary is not in a country that is on the list of third countries that can be funded. So yeah, please check your eligibility criteria before you submit. Any kind of preferences for cancer types relevant for prevention?
We have no preference whatsoever. As I said before, what is important for any of those proposals is that they clearly present the ideas and clearly outline the impact that they think would have in the area of primary prevention.
Thanks. And then a question on the contribution of SSH discipline. Can we give an example?
Yeah, so social science and humanities, what is important is an example is that we mentioned, for example, the active participation of NGOs, and we really welcome NGOs that have an expertise in those domains, social science and humanities, to deal with or sort of contribute to the social innovation parts of these proposals. The Cancer Mission is a lot about innovation, but innovation should not be understood solely as technical innovation. It's certainly a lot actually also about social innovation. So this would be a concrete example.
Yes, and I wanted to add to it, whenever we ask you about looking into social determinants, gender differences, acceptability of an intervention, that is when social sciences come in. When you want to look at mental health related issues, that is about social sciences. When you want to look at the economic aspects of something, that's social sciences. So social sciences and humanity is a very broad area with different types of disciplines. But it is really getting at what is relevant for society. So will the same cause be repeated, for example, pragmatic clinical trials? We have indeed, as you will have seen, focused on pragmatic clinical trials, one on treatment, one on diagnostic, and depending on how the things evolve, this is likely to be continued, but not maybe repeated exactly as they've been put forward in the current and past work programs. Jan, you want to add to that?
Yeah, no, the only thing I want to add to is what the applicant or what the participant has written at the top of the question is that how many applications for pediatric cancers were received and funded. So what I can say is that we have clearly stated in the previous topic, as we have stated again in this work program, we use a so-called portfolio approach at the time of evaluation, which is focused on pediatric cancers. And this is clearly written in the call text at the top of the call in the sort of in the table. And this guarantees that if a proposal is of sufficient quality, that means it passes all the evaluation thresholds, it certainly will be funded, because that is done to guarantee that this cancer mission is indeed able to support the transversal priority of pediatric cancers. So I cannot give you the exact number, but we see that it makes a difference, and every call topic we now are able to support pediatric cancer if it is over the scientific and other thresholds. Next question.
Yes, it's a question about the difference between a pragmatic trial and a randomized one.
Okay, so a pragmatic trial can be randomized and cannot be randomized. And randomized trial can be a pragmatic trial or so-called efficacy trial. So it's there's a difference, or there is not really a difference. So a pragmatic trial can be randomized or not randomized.
Yes, I think here we are mixing up two very different concepts, the concept of a pragmatic trial and the methodology by which you conduct the trial, whether you randomize it or not. So I suggest the person,
Correct. The next question is about the topic 4. Is this topic limited to childhood cancer survivors, or does it also include adult cancer survivors? So it focuses clearly on childhood cancer survivors, but these are childhood cancer survivors, adolescent cancer survivors, and young adult cancer survivors up to the age of 24.
Then the very open question, are there any kind of digital tools that are preferred or basically in mind? There the answer is no.
No, we have no preference, and we often get the question if, I don't know why, but for some reason there is the idea that the Commission prefers some things over others, but believe me, these topics, the only thing is we want to see is impact. So there is no preference whatsoever.
And then a rather broad question, can you comment on the relevance of behavioral change for the prevention of childhood cancer? I'm not sure. Yeah, go ahead, Jan.
I thank the participant for this very important question. We got the same question several times following our previous topic on primary prevention. We understand the reasoning behind this question, because when it comes to prevention of childhood cancer, and in this case behavioral change, you may think that this is not very relevant, but childhood cancer, besides having genetic components, it's certainly there is a relationship with the environment, and so it may be that behavioral change could be used in primary prevention programs to reduce childhood cancer or change the outcome of childhood cancer. I mean, one could start as early as targeting the parents or pregnancy. These are all, I think, areas that are still underexplored. But behavioral change, we know, because we have received in the past also other proposals in other programs on the same area of research. You could think also of obesity or any other issue that would be a risk factor for childhood cancer or cancer in adolescence or at the age of young adults up till and including 24 years of age.
Thank you, Jan. And also just to say that the prevention of childhood cancer can relate to the environment the child is raised in and the family or other settings. So you can have a broad perspective on behavioral change in that context. And then participation of civil society experts in research proposals. I think this is a general point. I think as a potential applicant, you have to think, what would I like, what I see relevant to research and who are the relevant stakeholders to be involved. And sometimes it is civil society experts, sometimes it's an individual patient, but it's certainly, we don't intend this to be a tick the box exercise, because that's not the purpose. The purpose is really to gather together in your proposal those groups or entities or people that are really will be contributing in a useful way to the research that you will put on stream and deliver results. So if I'm an example that is not related to the mission on cancer, but if you have, let's say, research that is conducted in a laboratory and for which the result will be transferred to be used in another laboratory, personally, I don't see why you need a civil society expert, unless you want to have someone that looks at animal models or things like that. But yeah, I'm sure that you will have a very nice answer to give.
No, I think your answer was very complete. It also comes back to what we said about social science and humanity participation. So I think this is well covered. If we can go to the next question, the participant asks, what is the difference between a normal and a pragmatic clinical trial? All these clinical trials, different types of trials, are quite normal. But I think you refer to exploratory and pragmatic clinical trials. So pragmatic trials focus on clinical effectiveness, and exploratory trials focus on clinical efficacy and safety. And that is a major difference, which means that at least in Europe, we see many more exploratory trials than we see pragmatic trials. The next question is whether a prevention trial can also be funded without behavioral changes in practice. Let's say the focus of the topic is clear in the sense that we like to see a focus on behavioral change. So if a proposal is submitted without clear ideas, objectives, tasks, impact on behavioral change, it may not pass the threshold.
And Jan, I think you already answered the next one, which is about adolescents and elderly, but maybe it's worth repeating because the question back.
Yeah, so indeed, this is a question we have gotten now several times. So we will put it also online in the frequently asked questions. So the requirement is that at the time of writing the topic, there are some sort of issues when it comes to explained to us by lawyers in the commission, that we have to be very careful when we write the words and or and/or. And so we decided to use the word and to show that the topic as a whole wants to address all these age groups. But as we have explained, and I explain now again, a proposal is fully allowed to address one age group, any age group it wants to address in its proposal.
Thank you. And then that one, the one on relevance of behavioral change for prevention, we already answered.
Yeah, I just want to add that, of course, I did not mention that one can also think of the school settings of the parents, so the family situation. You can think of sports, you can think of nutrition, diet. I mean, there are many things that you could think of when it comes to primary prevention and behavioral change and childhood cancers.
Yes, and then the question on the presentations, they will be made available on the website as well as the link to the YouTube recording. The success rate for the last call is good compared to usual Horizon Europe calls. How do you explain this?
Yeah, thank you for this question. This is quite easy to explain. So the last call, the mission call for cancer, was 2022, where we had a topic on pragmatic trials. So first of all, you noticed that for one topic, we got 0 proposals, and Barbara explained this. What we also noticed is that for 2 topics, the one on primary prevention and pragmatic trials, the number of proposals received was lower than we expected. And we think this has to do in part with the deadline that was right after the summer break, which probably was suboptimal, and may also have been due to the fact, at least that's what we understand, of our limited communication to stakeholders, to NCPs, about what these topics really focused on and what we really wanted to achieve. So that is the explanation. So that meant fewer proposals. Unfortunately, after the evaluation, it turned out that quite a good number of those were over the thresholds, and so that explains the high success rate.
Yes, and then there's a question, thank you, Jan, on what will happen to the Cancer Patient Digital Center. This is still an initiative that we want to move forward. I mentioned in my introduction that we are now financing a study that will develop the blueprint for the European Patient Digital Center. So what kind of model for this center would work? And we then, in discussion with the member states, we'll see how to best develop this patient digital center. It will not be born in one go, but rather it is a process of discussing what are the desirable future features, for such a center. What are the initiatives that already exist that can be capitalized upon, and which country or region would like to start with implementation. All cancer call. Why has the Commission opted for a separate ethics annex instead of having the ethics questions fully integrated in part A of the proposal? I must admit that this is a question that is not specific to the mission on cancer. It's rather the general approach to ethics that has been taken. And I don't know if either Jan or Janis, if he's there, has further clarifications on that. No, okay. Then a very open question. What are regions? I'm not sure how to interpret that. Annika, you want to come in? Yep.
I mean, I also was wondering, but I guess it means that what is cited in the topic, obviously, it means regions but I don't know whether there's a definition, but European regions. So there are, by country defined regions, which we refer to.
Yeah, so if I may add, so if you go to Commission websites, the participant is invited to do this. You will find that in Europe there are about 287 European regions.
And then Jan, you maybe want to address the question on the poorly understood cancer.
So let's say, when the cancer mission was being prepared, and we started in 2019 with the first cancer mission board, it was talking about understanding cancer. The board opted for poorly understood cancers, but we never sort of defined this in a more stringent setting, in the sense that we never specified, and we do not want to specify any specific tumor type. So the answer is no. Poorly understood cancers do not selectively refer to specific cancer types that you mentioned. Also, because the whole, let's say, objective of understanding cancer is focusing on poorly understood cancer, including poorly or poorly understood cancer subtypes. And so, even in cancers that we think we do understand quite well for the moment, for example, colorectal cancer, we may yet have to understand completely some of the subtypes. And as we are discovering almost every year new subtypes, even for very rare cancers, so it would be unwise to define those more specifically.
Thanks, Jan. And can you answer the next question, why the trials on poorly understood cancers do not have to be pragmatic?
Okay, so I think I would like to turn around this question. So if the participant wants to address in a pragmatic trial poorly understood cancers, it could do so in the topic on diagnostics. So then the focus is, of course, diagnostics to support treatment outcomes for poorly understood cancers. But in the topic on poorly understood cancers, the focus is not on pragmatic trials. The focus is different, and it's explained in the text.
And then there's a question of the participation of Australian entities in mission proposals. Australia is not yet associated to Horizon Europe, and it's not a low-income country. So the Australian entity would be welcome, but would not benefit from EU funding. So we slowly but surely are nearing the end. We'll wait 1 or 2 minutes more to see if there are still questions coming. How to overcome the problem that some calls get no applications and some too many? Well, I would suggest that you get in touch with your national contact points, and that national contact point comes to us with suggestions. I think what we've, as Jan mentioned, is the mission work program is novelty. We believe that some of the people in the research community have not realized that these work programs were there. And then as for example, the European Patient Digital Center is something really new. And the timelines for submission were quite for development of a proposal and submitting were quite short. It made it more difficult. Over time, the situation will improve. And I must say that all the calls have, except for the call on the coordination and support action for the Patient Digital Center, all the rest of the topics have received submissions. Yeah. Ooh, this is a very technical question that I'm not sure, that I certainly cannot answer, but maybe Jan can.
Yeah, I would like to thank Dr. Haske for this question. Let's say I think that in the mission call topics, there is no concrete opportunity to support what you ask for, which is extraction of radionuclides from raw materials, which is very much, I think, upfront of any application that we would expect. I do think, however, given the very broad range of topics on the Horizon Europe, I would think that there may be some funding opportunities, provided that the proposal includes this as part of a much broader number of objectives. And I think, again, this would typically be a question for the national contact points to do the research for you and see if indeed there are such funding opportunities available.
Then there's a question, if the health system in a country is not organized on a regional level, how could involvement of regions be shown? So you have indeed the former recognized European regions, but you have also, many countries have, let's say, an administrative organization with districts or provinces, and which by involving a subset at the national level, it would be the equivalent of a region. So it is the administrative delineation in different countries is different. Like Annika mentioned, we have the European regions that are referred to as a region, but then you can also work with a sub-entity in your country that is either a district or province or whatever other name there is for such a sub-entity. Okay, I think we can leave it at this. Thank you very much for your interest. Many very different questions. Also interesting to see that that the feedback that Janis gave on the implementation of Work Program 21-22 was of interest to you as well. So we get the feeling really that you are with us on the mission, so to speak. As I mentioned to you, the link to the YouTube recording will be made available, the presentations as well, and we will make sure that the questions that you pose today and any additional ones you may have will be put in a frequently asked questions and linked to the specific topic the question belongs to. I'm looking at Annika, if there's anything else that you would like to mention.
No, many thanks also from my side. I think also the questions, apart from the very technical ones, show the growing interest really also to relate between the different codes and how we build the work programs. There were also questions looking already to the 24, but we wanted to focus this session on the 23 codes. And as soon as there are more clarity, obviously this information will be shared, but now focusing and we prepare then there were many other questions. We will then prepare the answers in writing. Many thanks.
And last but not least, we refer you to the implementation plan for the mission on cancer that really gives you a good idea of the approach, the philosophy, but also the concrete actions that we are putting forward or are likely to put forward in coming months and years. So thank you very much, everyone. Have a very good afternoon, and I wish you already success with your future submissions if you plan to. Thank you.